Thank you for joining us for another episode on dental malpractice. In this episode, we're going to be talking about nerve damage from dental implant procedures. Dental implants are on the rise. Today, there are more dentists placing implants than ever before. This means that there are more inexperienced dentists placing implants and more dentists rushing through implant procedures. Thus, there are an increasing number of instances of nerve damage as a result of dental implant procedures.
There are two main nerves that are in danger during dental implant procedures. First is the inferior alveolar nerve. This nerve runs right through the middle of your jawbone. Second is the lingual nerve, and it runs along the bottom of your mouth near your tongue. Because both of these nerves are in the bottom of your mouth, you may have already guessed that most serious dental implant nerve damage cases are going to involve dental implant procedures on the lower jaw or mandible.
Now, let's talk about some of the more common causes of nerve damage during a dental implant procedure. A dental implant procedure involves numbing the patient, drilling a hole in the bone, and screwing a titanium post into that hole. Accidents can happen at any point, and dentists may injure the lingual nerve during dental implant procedures. This typically occurs due to an accident with a sharp object like a drill or a scalpel. However, because the inferior alveolar nerve is located in the bone where most of the implant action occurs, it gets damaged more often than the lingual nerve in dental implant procedures. So, let's talk a little more about how the inferior alveolar nerve gets damaged in dental implant procedures.
There are two main ways a dentist can damage the inferior alveolar nerve during a dental implant procedure. First, the dentist can damage the nerve with the drill while drilling the pilot hole for the implant. There are several ways this can happen. For example, if the dentist drills too deep into the bone, the drill may penetrate the inferior alveolar nerve canal, or the drill may fling debris or other material into the nerve canal. Also, the dentist may drill at too high an RPM or for too long, and this can cause the drill to get too hot and burn the nerve and surrounding tissues.
The second way a dentist may damage the nerve is with the implant itself. The implant post has threads, just like a wood screw, and a bone is not that different from wood. So as you can imagine, the tip of the implant can cause damage to the underlying nerve. For example, the dentist may screw the implant in too far and penetrate the inferior alveolar nerve canal. The dentist may also screw the implant down so close to the nerve canal that although the implant doesn't actually penetrate the canal, it causes excess pressure on the canal. This pressure can cause serious damage over time. Additionally, if the nerve canal is subjected to enough pressure, the roof of the canal may crack. The worst possible scenario is where the dentist screws the implant into the canal and into the nerve. As you can imagine, these types of mistakes can cause serious damage to the nerve.
There are many ways a person might experience nerve damage. Generally speaking, there are positive symptoms, which are new feelings, and there are negative symptoms, which are lost feelings. When we talk about positive symptoms, we're talking about buzzing, tingling, burning, or other odd sensations that a person did not feel prior to the nerve damage. Negative symptoms would include loss of feeling and numbness. If your inferior alveolar nerve gets damaged, you might experience numbness on the side where the dentist placed the implant, or you might get numbness on the lower lip, on your chin, or on your jaw. In the same way, you may experience tingling, burning, or other odd sensations in those areas. If your lingual nerve gets damaged, on the other hand, you may experience loss of sensation or the addition of odd sensations more around your tongue.
Thank you so much for joining us for another episode on dental malpractice. If you like this video, please smash like and subscribe, and we'll see you at the next one.